Hi everyone, Sandy Grove, registered nurse here again with Health Tracks at Home. It is not only seasonal flu season, it is also the National Emergency Preparedness Month. So we are going to talk over the next few weeks about the things that we should be doing this time of the year, including preparing during this pandemic, but also wildfires and earthquakes. So the Department of Homeland Security is where you go to find the information. It's called ready.gov. I would encourage you this week to go on that website and find out how to make a plan if you don't already have a plan. If you do have an emergency plan, it's a good idea to get it out. And we'll talk about some updates and some things that we can possibly do to make sure that we have the best possible care when we need it during a disaster. As you know, things are kind of piling on top of each other. So we want to be as prepared as we possibly could be. And if you are like me and do not have an emergency kit in your car as yet for earthquakes or in your home, you kind of have it scattered around, now is the time to get prepared. But today we're going to talk about things that help you get prepared for the pandemic. What is the difference between a cold, the seasonal flu, or COVID-19? So we're going to kind of hopefully give you some things that you should be able to go, this is this is that, this is this. They're very hard to tell the difference between the two. But as always, I get my information from reliable sources today from ready.gov and as well as the cdc.gov/vaccines website. They give us information about the difference between these three things that we're going to talk about today. It is seasonal flu season, as we have talked about for the last couple of weeks. Remember that the flu is different from a cold by a lot. So how do we tell the difference between cold, the flu, or COVID-19? Symptoms. First thing, symptom onset. This is a good way for you to tell if it's just a good old-fashioned cold or if it's something worse. Colds come on gradually. We kind of have time to go, oh no, I think I might be getting sick. Oh no, maybe I'm getting a cold. Oh, maybe it's just allergies. Oh no, I have a cold. So we have a chance to know that it's coming on. We know that we're getting sick. We know that it's there. With both influenza and COVID-19, it's very abrupt. We're all of a sudden sick. We don't feel well and we don't know what's going on, and it's very obvious there's something very wrong. The next thing, aches and pains. With a cold, it's very rare that we get those. They get very slight aches and pains, maybe for the first 24 hours, but usually people go to work and survive with colds. We are able to function. With influenza, it usually you have aches and pains, and they can often be severe, but not horribly bad, unless it's a really bad new flu that you've never had before. But with COVID-19, it is common, and it can be very severe, the aches and the pains. Chest discomfort or cough. With a cold, it's very mild, and it can be a hacking type cough from the drainage coming down the back of your throat, as we well know from a cold. And we get that hacking cough that can last for quite a while. With influenza, this can be common. The cough and the chest discomfort can be common, and it can be severe. But with COVID-19, this is the primary symptom that we differentiate, and we know, and we tell you, if you have chest discomfort, pressure across the chest, difficulty breathing, that's the number one symptom, that we identify COVID-19. So that makes it a little bit unique. Chills, very uncommon with a cold, very rarely get that. Fairly common with influenza, and it happens occasionally with COVID-19, but not for everybody, so it's not as common. Fatigue, sometimes with a cold, but very kind of rare. Usual with the flu. We definitely get fatigue with the flu, and we're kind of laid out for a week until we get over the flu. And it is common with COVID-19, and it can be debilitating. It can be extremely severe. Fever with or without chills. So a fever is uncommon with a cold, very rare, unless you've had a cold for quite a while and all of a sudden you get better and then you get worse again. Now you have a bacterial infection. You probably have a fever at that point in time and you need to go get some medicine for that. With influenza, it is common to have a fever, and it usually lasts for 3 to 4 days. That is one of the things that sets apart a cold from the flu is a fever. And then COVID-19, it is common to have a fever and the days are indefinite. It can last from 2 days to a week having a fever. So longer fever time for COVID-19. Headaches, rare with colds unless you end up getting a sinus infection, and that's bacterial, and then you end up getting headaches, but it is rare with a good old-fashioned cold. Common with influenza, comes with the debilitation part of influenza. And headaches only happen occasionally with COVID-19. It's not one of the markers for COVID-19. Nausea, vomiting, and diarrhea, uncommon with colds, common with stomach flu, but with regular seasonal flu in adults, it's rare. It is more often in children with seasonal flu. And it is rare with COVID-19. Sore throat, common with a cold, sometimes with influenza, and common with COVID-19. Sneezing, common with a cold. We usually know that's how we're getting a cold. We start sneezing like crazy. Sneezing is sometimes with influenza, but not usually, and it's very rare with COVID-19. It's not one of the symptoms. And then stuffy nose, common with a cold, as we well know, sometimes with seasonal flu, and very rare with COVID-19 as well. So to differentiate just a little bit, there are some symptoms that are specific to COVID-19, which help us tell the difference between regular flu and COVID-19. COVID-19 can have confusion, new onset of confusion, inability to wake up or stay awake. You just keep going back to sleep, or loss of taste and smell. We've all heard this one. So influenza comes on very quickly. Aches and pains are pretty uncomfortable. You can have a cough and chest discomfort. It can be severe, but not as bad as COVID-19. You can have chills with the flu, a fever that can last for a few days, and a headache with the flu. Usually those things go together. And with COVID-19, remember that primary symptom is severe shortness of breath and chest pain, where you really have difficulty breathing. And then the confusion, the inability to stay awake, the loss of taste or smell. And everyone says the same thing. It's extremely debilitating. Makes them very weak. They can hardly get out of bed. They start to feel better. They feel worse again. Then they have a day that they feel better. Then they feel worse again. It lasts for quite a long time. So that's the fever lasting for quite a few days, and the fatigue and the muscle aches and pains. So again, remember, with a cold, it comes on gradually and the symptoms are mild and no fever. With the flu and with COVID-19, it's very abrupt, and the symptoms that I've told you can go anywhere from mild to severe. So I hope that helps, giving you some kind of parameters to tell the difference between the three. It's very difficult. You can go online and you can find cold and flu side by side. They haven't added COVID yet, but I'm sure they will shortly have the third one on there so that we can have a little scale to keep at our house. So another thing that I get asked is, what is the emergency warning signs of flu or COVID-19? When do we need to go to the hospital, or when do we need to seek medical attention? In children, fast breathing or trouble breathing with any kind of virus, bluish lips or face, kids turn blue much easier than adults do. Ribs pulling in and out with each breath, especially in a baby. If you see that, you want to take them in immediately. If a child has chest pain, not normal, you want to take them in. Severe muscle pain, child refuses to walk. That's a good symptom that they have severe joint aches. Dehydration, there's no urine or tears when they're crying and they have a dry mouth. They're not alert or interacting when they're awake. Seizures, fever over 104. We know those things are bad and we're going to take them in. Children less than 12 weeks of age, any kind of fever, you want to get it checked. Fever or cough that improves, but then it gets worse again. Like I said, we go from a virus to a bacteria. You need to get medical attention at that point in time. Usually need antibiotics. And if there's any worsening of a chronic condition with kids. So in adults, the things that are emergency symptoms are difficulty breathing, shortness of breath, persistent pain or pressure in the chest or the abdomen, persistent dizziness, confusion, inability to arouse, wake up. Seizures, not urinating, severe muscle pain, severe weakness and unsteadiness, fever, cough that it returns. Just like I said, you can end up with a secondary infection, and worsening of a chronic medical condition. As we know, a lot of people die from seasonal flu yearly, and it's usually from one or two things: dehydration or pneumonia. So when you start having any of these kind of symptoms, you need to be in contact with a physician, especially during this COVID season. We want to make sure you get excuse me, treatment as soon as possible to prevent any kind of complications. Then COVID-19, what are the emergency things that you're being told? And you've probably been told these quite a few times, but I'll reiterate them. Difficulty breathing, persistent chest pain, and pressure on the chest. New confusion, inability to wake or stay awake, and bluish lips or face. So make sure you get attention if you have those things. I hope that setting these three things side by side has helped a little bit. I hope it helps you remember a few symptoms that differentiate the three. And as always, like I said, I get my information from reliable sources. But as you know, things can change from day to day or week to week. Please, if you have any questions, contact your medical provider and have them give you the guidance that you might need. From all healthcare providers that care for you, please schedule your annual seasonal flu vaccine as soon as possible. With the changes due to COVID, there may be some delays, there might be a waiting time, and we want everybody to get vaccinated by the end of October. So please make sure you make that a priority this week and make an appointment. They're all by appointments at this point in time. Until next time, you take care and God bless.